Hi, I'm Dr. David at Magnolia Skin Center. Let's talk about a really fun subject. I've talked about Agnes already on other videos. You might want to look at those. Today we're going to talk about the Agnes radiofrequency used for acne and scar treatment. Okay, and again, Agnes is a technology where I have needles that are insulated at their hub, and when I go in, the energy can be delivered under the skin at high levels to heat to get an effect under the skin, which will cause your skin to regenerate and reverse age. Just to remind you sort of how Agnes radiofrequency works. So let's get into these questions, okay? Will this permanently stop my painful chronic cystic acne from flaring up ever again? Well, nothing can ever stop, can say that chronic cystic acne would never flare again, okay? However, I will say that because we are targeting specific glands where you've got cystic acne problems, we are over time decreasing the number of targets that really can develop into cystic acne. So you're not only that, but we are reverse aging your skin, and we're improving the quality of your skin. We're regrowing your collagen, elastin, and fibrin, and giving you healthier skin that's less inflamed. So with time, your acne condition is going to improve with this treatment. If you destroy my overactive oil glands to stop the acne, will it make my face dry and flaky? No, absolutely not. So because we are going after specific oil glands that have become diseased with cystic acne, okay, they are not really functioning as oil glands anymore. They've just become sort of an inflammatory, damaged mess. Okay, so we are basically just taking out those destroyed oil glands because they have been destroyed by the process of cystic acne. So they're no longer actually working as productive good oil glands. So we're not actually removing anything that's still working. Okay. Can this smooth out deep pitted ice pick acne scars, or does it only work on red active bumps? Yes, it can smooth out the deep pitted ice pick acne scars because those are areas that have been scarred and destroyed, and so they've lost connective tissue. So this is going to bring back connective tissue so that they begin to fill back in and look more normal again. Okay. Um, will this cause my acne-prone skin to experience a massive, embarrassing purging breakout? No. So taking out the areas that are inflamed and getting them under control is not going to stimulate more inflammation to activate in other areas. Okay. How many sessions will it take to finally get clear, smooth skin that I don't have to hide with makeup? Obviously, everyone's different and it depends on the severity of your case. If someone has a large amount of very active lesions, it's going to take longer for us to get to our endpoint of nice, smooth, beautiful skin. Whereas if you have a milder case or a moderate case, it's going to take less sessions. So it just depends on where we're starting from. Okay. Is this going to damage or burn the healthy skin surrounding my old acne scars? No, because this is very targeted where I'm delivering the energy exactly to the damaged, inflamed, cystic areas that I want and not to the healthy, normal skin around it. Do I have to stop using my prescription acne creams or face washes before I get this done? That's a great question. Here's the thing too that I want a lot of you to understand. A lot of the treatments that are being done that are topical for acne actually are hurting and causing problems. So what happens when people start getting acne is they start getting more aggressive with cleaning and astringents and soaps and detergents. And the problem is that actually does two things. It removes your natural oils, which are protective, which you actually don't want to do. So you're left with dry, undefended skin, which actually makes the condition get worse. And then soaps and detergents are bases, and your skin actually likes to be acid. So it's changing. So soaps and detergents are changing your skin from being sort of acid to get to going to a high pH or a basic pH, which also damages your skin. So the more we can stop you from doing the astringents and the detergents and the cleansers and the soaps and all these things, the better it's going to be for you. And specifically, we also don't want you doing anything that's damaging, like salicylic acids or retinoic acids or other things that may trichloroacetic acid that may actually damage your skin. And the retinoids or tretinoids, which can be very good for acne, don't get me wrong, but they also can cause some inflammation if depending on how much you're using. And we don't want that for about a week or more before the treatment, just so that we don't have any retinoic or tretinoin response going on your skin when we start doing this treatment. So I hope that that helps you understand a little bit more, but please just come in and let's talk, let's educate. And I'm Dr. David at Magnolia Skin Center.